Welcome to our section on performing chemical peels. This segment will guide you through the common step-by-step procedures required to ensure safe and effective chemical peel treatments. The first step is a thorough patient consultation. Assess the patient's medical history, skin type, and treatment goals. Discuss any contraindications, allergies, or previous skin treatments that may impact the suitability of the chemical peel. Instruct the patient to discontinue the use of topical skincare products containing retinoids, AHAs, BHAs, or other exfoliating agents before the procedure. Ensure the patient's skin is clean and free from makeup, oil, or debris. Evaluate the patient's skin condition, including texture, tone, pigmentation, and presence of any lesions or infections. Determine the appropriate type and depth of the chemical peel based on these characteristics. Prepare the chemical peel solution as prescribed. Apply the solution evenly to the treatment area using a brush, cotton pad, or applicator, ensuring complete coverage while avoiding the eyes, lips, and mucous membranes. Monitor the patient closely during the peel application to assess their tolerance and skin reaction. If necessary, neutralize the chemical solution with a neutralizing agent like saline or bicarbonate of soda to halt the peeling process and minimize adverse reactions. Provide post-procedure instructions, including skincare recommendations and sun protection guidelines. Advise the patient to avoid excessive sun exposure and harsh skincare products in the days following the peel. Schedule a follow-up appointment to evaluate the patient's skin response to the chemical peel, address any concerns or complications, and assess the need for additional treatments or adjustments to their skincare regimen. By following these common steps, you can perform chemical peels safely and effectively, ensuring optimal outcomes for your patients. Let's continue to explore the intricacies of facial rejuvenation techniques.